welcome. You are here for your appointment. Perfect. Can I have your name? Okay. Great. And just your date of birth, just to make sure it's really you. Okay. Okay, there you are. Perfect. Hi, hello, welcome. Today I'm going to be conducting your cranial nerve exam. Have you ever been to a cranial nerve exam before? Okay, so you're like a little bit familiar. Okay, that's pretty good. So basically all I'm going to do is just test all of your cranial nerves, just to make sure everything is functioning the way they should be. Yeah, okay. Perfect. So just gonna write down. So how many cranial nerve exams have you been to in the past? Okay. Gotcha. Okay. Well, here at this cranial nerve exam, we are solely focused on the relaxation aspect of it. So we have many clients who just nod off during the process. It's completely normal. It's completely fine, and it doesn't mess up the test at all. Yeah, just a little flex on the other cranial nerve places that don't involve relaxation. Okay, we're just gonna move on. Okay, there we go. So first, just going to begin with your vision. So if you want, you could just kind of just roll your head around, get a little relaxed before we do the test. Okay, I'm going to place my checklist down right here. Okay, and we're going to go on with just a little bit of you following. So here, my pen has a little bit of an indent, so I want you to stare at the tip of my pen and just follow it, okay? Perfect. Okay, good job. Okay. I'm gonna get a little bit closer. Keep staring. We're gonna get a little bit further. Good. Get a little bit closer. Okay. And a little bit further, okay? Your eyes are doing great. Okay, perfect. I now want you to just stare at my nose and just don't look at anything that's moving, okay? The pen's gonna come across my nose, that's okay. Just keep staring at my nose only. Okay, perfect. I'm gonna quickly cover one eye. Good. And just follow the tip of the pen in a circular motion. Okay, gonna get a little bit closer and further. Okay, perfect. Gonna do that with this eye too. Follow it in a circular motion. And just gonna get a little bit closer and a little bit further. Okay, good job. I can mark you up. I can mark you down for the eyes. You did really good. We're now going to go on to light, okay? So, I'm just gonna quickly check your pupils, okay? So it's gonna be pretty bright light, so if you're a little sensitive, just a little news flash for you, okay? I'm just gonna kind of look at how your pupils dilate. So I want you to look at my nose. Okay. Keep staring at my nose. Okay. Good. And good. Perfect. Okay, I want you to follow the light. I want you to identify where the light is. Just quickly follow it. Okay. Good. Okay, I want you to try and avoid the light now, so I want you to look anywhere but the light. Don't look at anywhere else, or look at anywhere else but the light. Okay. Perfect. You did good. I'm going to cover one of your eye. I want you to just stare straight ahead, not particular or anything. Check. Okay. Cover this eye. I want you to look straight ahead again. Nowhere in particular. Okay. I'm going to just shine this light right here. I want you to move your eyes up. Okay. Move your eyes down. Good. Okay, I'm going to move that over here. I want you to move your eyes that way. Good. And move your eyes that way. And now just move your eyes in a circular motion, very briefly. Perfect. Okay. Everything looks good. So far, so good. So, good on that one. Okay. We're now going to go on to looking at which lens, okay? So basically this is just to see if you can tell the difference between a clear lens and a obstructed lens. It's very easy, so no need to worry. I'm gonna open these pair of glasses right here. Okay, and I just want you to tell me which lens is clear. Is it this one? Or is it this one right here? Okay, so it was a little bit blurry in the beginning, but it's clear. Okay, that's good. That's okay. That's what these lenses do a little bit. Kind of get your eye to adjust a little bit. Let's see. I want you to tell me which lens is clearer between this lens, okay, and between this lens right here. Which one is clearer and you can see better out of? Good job. Okay. Good, good, good. Told you, very easy. Now, what I'm going to do really quickly is I'm going to put on my gloves because we're going to feel around your kind of tonsil area. Just make sure everything feels fine right there. We're gonna do some muscle testing and facial movement exercises just to see everything is going good, okay? Okay. So first, what I want you to do, actually, look at me getting ahead of myself. Oopsie daisy. We're actually going to just quickly look over these colors really quickly just to see how you perceive color, okay? No biggie. So, just to look at this. Okay, what color is this one? Red. Perfect. Can you tell me what color is this one? Right here. Green. Good job. How about this one? This one right over here. It's yellow. Good, good. And how about this one? How about this one right here? It's pink. Good, 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 good. Okay, I could check you off for that too really quickly. Okay, perfect. So, really quickly now, we're going to go back onto your facial movements. So what I want you to do is just do a, don't hurt yourself, but do like a light little forceful blink, just like that. Okay, perfect. I now want you to just quickly open your eyelids really, really wide. As wide as you can. Perfect. Okay, and can you do a big, big, big smile for me? Super big. Super cheesy. Okay. Perfect. Can you now just raise your eyebrows? Just like that. Okay. Great. And now I need you to just open your mouth as wide as possible. Just like that. Okay, do you feel any tension here? It's a little bit difficult. Okay. Perfect. Okay. Now going to go on to just blinking. So I want you to open your eyes. I'm going to very gently place my fingers on your eyelids. I want you to just try to close your eyes. Very gently. Just try to close. Okay. Good. Okay. I'm going to have you close your eyes now. I'm going to gently lay my fingers on the top. And I want you to try to open your eyes. Okay. Good job. I now want you to just relax your face right up here. So I'm trying to get all the tension out. Okay. And I'm going to place my fingers above your eyebrows. Just try to raise them the best you can. Okay, good. I want you to do one more big smile. I'm just gonna feel the sides of your face really quickly. Okay. Perfect. Not too bad, not too bad. Okay. I want you to straighten your face up just a little bit. I'm just gonna feel right here. Okay, I'm not feeling anything. You're doing good. Perfect. Okay. Perfect. I'm gonna check you out for that and check you off for that. Now I want you to do is just open your jaw. Just nice and loosely. I'm going to place my hands on either side and I want you to just try to close your jaw. Okay, good. And I want you to close your jaw. And I'm going to place my hand underneath and just try to open it. Okay, good. I now quickly want you to do a pucker. Just do a pucker. Just like that, good. And now pufferfish it. Pufferfish. There we go. It's a little silly, but you looked cute doing it, so. Okay, we're now going to get onto the sensation touch, okay? So just briefly, I want you to tell me on a scale from 1 to 10, how much did you feel that? Okay. And that? Okay. And you felt that? Good. How about that? And we're going to try the nose. Perfect. We're going to try the side right here. Okay. And right here. Good. Perfect. We're now going to go on to a soft or dull test, or soft or sharp, but technically they're both kind of on the dull side. Just one's ultra soft and one's just kind of on the tougher, harder side. Okay, perfect. So I'm gonna ask you to close your eyes. Close your eyes, okay? And I'm just gonna tap your face and just tell me, is it hard or is it ultra soft? Okay, ready? Perfect. Good job. Good job. Okay. Perfect. And just one more. Good. Okay. You did such a good job. Okay. Gonna mark you off for that. Perfect. Okay. We are now on to smell, but we ended up having a shortage in supply, so I'm gonna just have you smell some random objects and just have you tell me what it smells like, okay? Okay, here. Take off my gloves really quickly. Okay, so here we have this, okay? Just want you to just take a quick little sniff. Just tell me, what do you think that smells like? What do you think that smells like? A roll of tape. Perfect, okay. Now I want you to just smell this right here. What does that smell like to you? Good, it smells like a pen. Perfect, okay. Now I want you to just smell this right here. Just take a smell. Good, it smells like a ruler. It is a ruler. Good, good. And now I want you to just take a quick little smell of this. Okay, and now I just want you to just take a little smell. Just take a little smell. What do you think that smelled like? It smelled like a cuber. Good job. Okay. You did that perfectly. I'm gonna mark you down as 100% for that. Even though due to the lack of smelling resources we kind of ran into. That's okay. Now for your last one, we're just gonna quickly test your hearing. That's super straightforward, super easy. It's gonna require you to keep your eyes closed the entire time, and I just need you to tell me if a sound is closer or farther away from your ears, okay? Perfect. So, okay, so I'm gonna have you just close. Okay, perfect. I'm now going to do 2 little clicks, and I want you to tell me if click number 1 or click number 2 is closer to you, okay? Ready? Good. One more time. Perfect. Now that one was a little bit tricky. They were both closed. 2. Good. 1. Good. Perfect. Good, okay. I want you to keep your eyes closed and just tell me if click number 1 or number 2 just sounds louder. So not necessarily closer to you, just which one sounds louder to your ears, okay? Ready? one more time. Okay, you did good. That was all for the hearing test. Going to quickly write down your results for those. Okay, I'm going to send your results in, and you'll get just a copy of your results in the mail like 2 days. Okay? Well, you are all done. You did a perfect job. I'm super proud of you, and I hope you have a very good night tonight.